The topic of discussion is atrial myxoma. Now here the pattern of our discussion will be there is one clinical case related to atrial myxoma, and we'll be understanding in brief about atrial myxoma and about what the differential diagnosis that it can have through these clinical case. So now without delay, let's move into our discussion. Talking about atrial myxoma, it is what it is, the most common benign tumor, right? Benign tumor of heart, right? And talking about the most commonest tumor of heart, that is our metastasis. Now what is this atrial myxoma? It is, okay, let us suppose in this our schematic diagram, this is, what is this? This is our, what is this? This is our tricuspid valve, this is our mitral valve, right? Okay, now above we have got what? We have got atrium, and below we have got ventricle. So now here this atrial myxoma, it is pedunculated tumor. That means the tumor having peduncles, right? Okay, suppose this is what? This is our tumor. Okay, this is our tumor. Now this tumor is having attachment, it is having peduncle, right? So it is called pedunculated tumor, right? Now here, because of this peduncle, this tumor is freely floating in lumen of what? What is it? This is our left atrium, right? now see, now whenever there will be what? Whenever there will be opening of our this mitral valve, right? Whenever there will be opening of mitral valve, there will be what? There will be flow of blood from this region to this region. Now in this condition, what will happen is that this tumor, right? This tumor, which is what attached to the wall of left atrium, now this will be also pushed and it will go and strike right here into what? Into mitral valve. Now because of this striking into mitral valve, what will happen? There will be auscultatory finding, and that is what? Tumor plop sound, right? Tumor plop sound. Now tumor plop sound, okay, there is auscultatory finding, that is tumor plop sound. Now this tumor plop sound, it is what? It is low pitched sound, low pitched sound, low pitched sound. Now as I've already mentioned, what I'm saying is that this tumor, it moves like what? It moves like pendulum, and it strikes mitral valve at the time of what? At the time of what? Opening of this mitral valve, right? At the time of mitral valve. Now as the time progresses, what? As the time progresses, what will happen? The size of this tumor will also grow. Now as the size of tumor will grow, now here as it strikes right here, what will happen? It will also act like what? It will also act like mitral stenosis, right? It will also act like mitral stenosis. So there can be the confusion, right? There can be the confusion what? Between what? Mitral stenosis and our these what? Atrial myxoma. So now moving further, right, I have already mentioned, right, how we are going to differentiate our this mitral stenosis and our this what? Our this tumor plop sound, sorry, our this atrial myxoma. Okay, the one thing is that what? One thing is it will produce what? It will produce in auscultatory finding, there will be tumor plop sound, right? That is one important thing. Now because of what? Because of this blocking of our this mitral valve, what will happen? Enough blood will not reach into what? Our this ventricle, because of which symptom of breathlessness are increased, right? Symptom of breathlessness are increased, and especially it will occur at the time of what? At the time of sitting position. That means when person is sitting, right? When person is sitting at the time, what will happen? There will be effect of gravity also, right? As there will be effect of gravity, now this tumor will go and it will just what? It will just attach near what? Our this mitral valve. So at the time of breathing, the person will feel what? More breathlessness, and that is what we call what? That is what we call platypnea, breathlessness increased in sitting position. But at the time when person is supine, in supine position, what will happen? There will be no effect of what? Our this there is no effect of our gravity, because of which the person will feel relief, he will not feel such symptoms. So yes, okay, the size of what? Our this mitral valve is about what? 4 to 6 centimeter, right? Centimeter square. Okay, now we talked a bit about what? Our this what? Our atrial myxoma. Now let's move into our what? Clinical case. Now in this clinical case, as you can see, there is one young female. Okay, we're talking about what? We're talking about young female right here, came with complaint of effort intolerance. She get tired very soon. Okay, now because of this symptom, what was she prescribed? She was prescribed iron supplement, because what? Iron supplement was supplied because the doctor thought that she was having what? She was having less what? Less production of RBC, because of which she was feeling what? Effort intolerance, right? Okay, and she was getting tired so soon, but her symptoms were not relieved. That means after having iron supplement also, the symptoms were not relieved, and she came back after how many? 1 to 2 months. Her breathlessness was increased. That means what? As the time progresses, what will happen? The tumor, which was this much size, it grew larger, because of which the breathlessness was increased a lot, right? Her breathlessness was increased so much that on going to washroom also, she was developing what? She was developing breathlessness, and she also developed what? Platypnea. I have already mentioned platypnea is a condition in which the person feels breathlessness at the time of sitting position, and this is what? This is one of the important finding, right, in our this case. Now because of this, so the keyword in this case scenario, what is the keyword? What are the keywords? The keywords are our what? The young female. The first thing is young female, effort intolerance. She is having effort intolerance. And another is she is having dyspnea. Why dyspnea? Because why? Because of what? Why dyspnea? Okay, breathlessness. She is feeling breathlessness. Why dyspnea? Because as there is what? There is blockage of what? Our this there is incomplete blockage of this mitral valve, because of which the blood can reach what? It can reach into lungs, right? It can reach into lungs, because of which there can be pulmonary edema also, right? It can reach lungs, pulmonary edema, because of which there can be dyspnea. So the key finding are what? Our breathlessness or dyspnea also. Similarly, the most important is our platypnea, right? Platypnea. Okay, now on examination, what we will find? I have already mentioned what? One of the key finding of our this atrial myxomia on what? On our auscultation is our what? Tumor, right? Plop sound. Now tumor plop sound, it is low what? Low pitch sound, right? Pitch sound. And we have already discussed that low pitch sound are heard with the help of bell in stethoscope, right? With the help of bell in stethoscope. Now talking about low pitch sound, there are only 3 low pitch sound. One is our S3, S4, and this our tumor plop sound. These are only low pitch sound that we discuss. Other everything that comes, they all are our high pitch sound, and they are heard with the help of what? Diaphragm. That's all. Now talking about examination, yes, already we have said that tumor plop sound is heard, right? The first is tumor plop sound, yes. And talking about other examination, right? Other examination, there will be what? There will be lungs crepitation also. Lung crepitation, crepitation means what? There will be bilateral finding of lung crepitation. That means abnormal sound will be heard at the time of what? Breathing, right? And it is found with the investigation of choice for this lung crepitation is our what? Transesophageal echocardiography, right? Now how we are going to treat this condition? We are going to treat this condition by what? By resecting it. Surgical resection is done for treatment. That's all. Now prognosis is good if it is early resected. That's all. If it is early resected. Now what can be other differential diagnosis of this condition? The other differential diagnosis can be this, right? Now here if you'll see, we are showing out this tumor right here into what? Into the leaflet of our mitral valve, right? Now what is this condition? This is papillary elastoma, right? Papillary elastoma. But here this papillary elastoma, okay, now how we are going to distinguish this papillary elastoma and our what? Atrial myxoma. In atrial myxoma, what we have platypnea, right? Platypnea. But here you will not see platypnea. Here the condition is same in sitting and in standing position, because it is attached with what? Attached with mitral valve. So that is what? That is our how we are going to differentiate papillary elastoma and our this atrial myxoma. So this much for what? Our this atrial myxoma. And with the end of lecture, I would like to mention some important fact. Most common tumor of heart, what is that? That is our metastasis, and metastasis mainly from what? Oat cell carcinoma from lungs, right? Of lungs, or cell carcinoma of lungs. It can be also metastasis from breast carcinoma. It can be also because of malignant melanoma also, right? And talking about the most common primary malignant tumor, right? In the case of what? In the case of adult, that is angiosarcoma, right? I'm talking about what? Most common primary malignant tumor, right? And talking about most common benign tumor, we have already discussed what? Benign tumor, that is our atrial myxoma. And talking about the most common primary malignant tumor in children, that is rhabdosarcoma, not angiosarcoma. So in pediatrics, we mentioned rhabdosarcoma as the most common malignant tumor of heart, whereas in the case of what? In adult individual, the most common primary malignant tumor is our angiosarcoma. Okay, that's all for what? That's all for our atrial myxoma. Thank you and have a great time.